As of the end of 2024, we have 66 cases identified in humans, over 900 herds of dairy cows, and millions of birds affected by H5N1 avian influenza.
We're seeing a lot of transmission occurring in animal populations that gives a breeding ground for the virus to change and potentially become more infectious. What we haven't seen yet is any kind of sustained human-to-human transmission.
What it comes down to is the reason it's all hands on deck and people are concerned is eventually it could cause human-to-human transmission and become a serious epidemic in the United States or potentially a pandemic.
What's important to recognize is that this is an outbreak that's been going on since 2022 in the United States, but up until 2024, this primarily had affected poultry productions. But now that we have the outbreak in dairy cows, there's a new genotype or strain that has been circulating related to those cows, and that's where a lot of our cases, but not all of them, have come from.
There's going to be more routine testing on dairy farms and of milk supplies, and that's extremely important, and that's welcome news. I think one of the problems that we have, especially as we move into influenza season, is that there's the risk that if you're a physician, if they want to do influenza testing, they're only really testing for the usual seasonal influenza. They're not testing for H5N1, because that type of testing is not widely available for people.
First and foremost, I would say, let's make sure that we're using the health interventions that we know have a track record. First and foremost, pasteurization, I think, is really important. Secondly, influenza vaccination, I think, is still important.
If an individual, let's say a dairy farm worker, gets infected with H5N1, that same individual also around the same time gets seasonal influenza, so that individual has two different viruses in their system, and then those viruses could reassort to produce a hybrid virus that could then transmit more easily from person to person. It's really important that we convince all Americans to get their seasonal flu vaccine so that reassortment possibility becomes less likely.
There's a lot of vaccine development going on, and so we're anticipating that there are going to be trials of H5N1 vaccines starting in the new year. And so we should have data fairly soon about whether or not those vaccines are able to elicit the kind of response that we think would be protective. We are in a much better position at the end of 2024 than we were at the end of 2019, when we had the reports of the first cases coming out that eventually turned into the COVID pandemic.